Okay, good morning. This is Senate Health and Welfare. And it's April 30th. Unbelievable that the month has gone by. This is, so we're gonna take some time this morning to look at a new draft of S-25. That some of the work that we did last week on the bill. And then we still have another area to sort of discuss, and that's on the lead and in the cosmetics. So why don't we, Katie, put the new draft up and you can show us the changes that you've made.
Sure. Good morning, Katie McDonough, Office of Legislative Counsel. Here's the new amendment. This is a strike all amendment because I think it makes it easier to read.
Yeah.
So I've highlighted the changes in yellow, but just to remind you what your changes were. You made a decision to add enforcement language in all of the subchapters. And you also made the decision to move up the date of the athletic turf, the effective date. And so what that looks like is it's no longer in a standalone section, but it's integrated into a larger chapter that all take effect on a date certain. So, first is the subchapter on cosmetic chemicals and cosmetic and menstrual products. And if you scroll down to the end of the subchapter, you'll see that there's a new section added, 2494C. This is the language, the exact language that we were looking at last week. Violation of this subchapter is deemed to be a violation of section 2453 of this title. The AG has the same authority to make rules, conduct civil investigations, enter into assurances of discontinuance, and bring civil actions, and private parties have the same rights and remedies as provided under subchapter 1 of this chapter.
So that's kind of the boilerplate.
That's pulling in all of the consumer protections, enforcement authorities that the AG's office has. So you'll see this section repeated 3 or 4 times throughout this bill. So next, we're amending.
Is this kind of to counter, what I think you guys, refer to as private right of action? Was that private right of action ever an issue with this?
That was in 121, where we're looking at for privacy, but this does have, Katie, this does have.
It does, yeah.
Right of action in it. So can you talk a little bit about whether or not this is consistent what we do with what we do for consumer products overall?
Yeah, a few weeks ago, we looked at, so if you remember, this bill is moving a lot of existing law from Title 18 to Title 9. So we went back and looked at what was in Title 18 because the enforcement language didn't get carried along with it. And there is private right of action in Title 18. So that informed your decision to keep it in this language here.
Okay, so it's not a conflict to have both the.
It's two options.
It's 2 options, but both are viable at the same time. The Attorney General and the private right of action. Again, I'm not a lawyer.
Yeah.
I
I would say potentially, but I would, if you are planning to hear from the AG's office, that would be a question about how exactly that works in practice.
We have the AG and, well, she's in on 121 tomorrow. Do we have her? Also 125, they're both, okay, yeah, we did ask her to comment on this, so that's good. Yes, we have her on both. So you'll be able to ask your question.
This is language that's already in the AG's chapter. So I assume that they have plenty of experience on how that would work in practice. Okay. The next subchapter is PFAS in consumer products. If you remember, this is sort of a larger subchapter, and it deals with many types of consumer products. In a previous version you saw that came over from the House, there was not a section on artificial turf as part of this subchapter right now. Instead, this language was in a standalone section. And the idea was that it would take effect at a later date. I think it was 2028 was the later date that the House had. So by moving this language into the subchapter, you're having the same effective date apply to the whole subchapter. Okay, and then you have your enforcement language at the end of this subchapter. It's identical. Next these are changes. There's a lot of numbering changes because I removed a section of the bill. So
You'll
you'll
have
see
to
that.
double check those, right? No, no,
That's what the yellow highlighting is.
yeah, good, okay.
And then the subchapter on firefighting agents and equipment. You've added your enforcement language in this subchapter as well. There it is. And then you have a subchapter on chemicals of concern in food packaging.
So, but that, and the chemicals of concern in food packaging is already in statute.
It is, and
So
it's being
there's a
removed.
lot here that's already in statute,
Yeah.
already covered by these enforcement actions.
No, because they're not being carried, yes, an
Okay.
existing law, an existing law.
Existing
But the
law.
way this is drafted, it didn't carry that enforcement language over with it.
Right.
So unless you add it, it will not.
So while we're asking that, was that a deliberate decision on the part of the House not to carry the enforcement over?
I think there was a thought, that because it was moving to the subchapter or the chapter on consumer protection, that the protections in that chapter automatically would apply, and that's why it was left off. However, most of the other subchapters within that subchapter do carry their own enforcement language. So if that is your intent, I think it probably is.
Okay.
It adds clarity to spell it out. And then.
What we'll do is we'll finish looking at the draft that you've brought us.
Okay,
Take a break to listen to the folks from judiciary,
okay,
and then we'll come back to our conversation on that.
okay. That's really it for the changes. It's just updating section numbers because we've deleted this.
And then the date for, what's it?
Yes,
Okay, so it's in section 4.
it's in section 3, PFAS and consumer
Ah,
products, so
okay,
the
there.
January 1, 26 effective date for well, not for everything, but for all of the products, including now the artificial turf.
Okay, thank you. Questions for Katie on this? Good, thank you for doing that.
Yeah, you're welcome.
And maybe it's belts and suspenders, but it's there.
Okay.
All right, so I think we have something regarding H72, is that right?
You do.
Senator Hashim, is that you?
Yeah.
Thank you, okay.
So, and, I sent the amendment to Kiki, so,
Maybe you can put it up on the screen.
or I can put it up if you.
Okay,
send me a Zoom.
all right, why don't you do that?
Just gonna send me a Zoom.
So remember in H72, there was, so there were some concerns expressed by the, chair of judiciary, and, he brought the bill into his committee to look at it. Soon as we get it up, we'll. Want to start?
Yeah, sure. Thank you for having me, Senator Hashim, for the record. So far, this amendment has to do primarily with civil claims related to DUIs. And there's also a catch-all provision for claims that are unrelated to provisions of overdose prevention services. But long story short is that the immunity provisions that are provided in H72 will not apply if the basis of a civil claim involves somebody operating a motor vehicle while impaired by a drug. And then there's the catch-all for claims unrelated to provisions of overdose prevention services.
So
Pretty
that,
much it.
so when you talk about the immunity at the center will not apply for someone who goes out and drives a car.
Right.
Yeah, and they're stopped, they're liable for their actions.
They're still liable,
Yeah,
you know, if it's, you know, if it's a car crash, they drive into someone's house or something, they crash into another car, you know, there's the civil claim that can still happen. And then there's also the criminal claim or the criminal charge that can still happen outside and beyond. And, you know, for circumstances that are unrelated to DUI, you know, this spells it out pretty clearly. But in other circumstances where there's lots of different facts, a judge will interpret those facts and make a decision as to whether or not an action outside of the center can be considered related to the provision of services.
So if the center doesn't put salt down in the middle of winter and somebody slips and cracks their head.
Well, I think common law, well, I know common law negligence would still apply to that. I don't think that this would not create immunity for that.
Got it, okay. And I think we had talked about that in here, but it's nice to have it validated and actually improved, so. Any questions for Senator Hashim? Yeah. And we will have Michelle come up too.
Okay, good. I'm just wondering, can you kind of backtrack a little bit? So the immunity provision does not apply to the center if it's in a civil case, if a client.
The immunity wouldn't apply to the individual who is operating. So I think a similar analogy would be, if you're at a bar and you drive away drunk, you're still liable for driving drunk afterwards.
So what about, so my understanding is the bartender, in that scenario, the bartender in the establishment is responsible, has a responsibility in that scenario as well, that they're not immune to the patron over drinking. They're supposed to be monitoring. Is there any parallel here to the?
Yeah, that's a good question. I think that, it has to do with the provisions of services. So and again, it depends on, the facts that are presented in such a case, if somebody, this is speculation, which, but,
I'm gonna let us phone a friend, so when we have Michelle up, this sounds like a question that she may wanna help us out with.
that's a great idea.
He's doing a great job, but
With this particular amendment, it's about the immunity of the patron who's come in and out of the
Yeah.
action center. Okay.
Yes.
Just want to make sure.
I'll just join, is,
Oh,
is that
good.
okay? If
That's
we're just
good.
both up here?
No, double the trouble.
Okay.
2 lawyers.
So, so for the record, Michelle Childs, Office of Legislative Counsel, and I think that the amendment that's before you is in keeping with your intent of the underlying amendment. So I know that we discussed the issue quite a bit around criminal liability under it. And remember, it only applies to immunity for possession. And so if someone were to be impaired in their driving, they're still liable under 23 VSA 1201. There's no issue there. And kind of just in talking about these things, the Senate Judiciary thought it would be helpful to be very specific about certain things because that's a question that comes up, and didn't want there to be any vagueness around someone, making the argument that they wouldn't have civil liability. So if that person was impaired and they were in violation of the DUI statute and they got into an accident, and then the person who they had an accident with was going to sue their insurer or whatever, that is not, that immunity does not extend to that. And I do think that was your intent. So there's just kind of some bolstering language here. And then on the other issue, there's lead-in language that you have in your underlying amendment around the immunity protections for participation in or with an approved overdose prevention center that is acting in the good faith provision of an overdose prevention services and in accordance with guidelines established by the Department of Health. And so it's around the provision of those particular services. And so the issue that the chair brought up around if you don't salt your sidewalk and you don't take those types of things. So the immunity is focused on the provision of the services, it doesn't mean that you would then therefore that immunity would extend to not keeping your walkway clean or things like that.
Does that answer your question?
So I'm not quite sure I see the parallel of salting your sidewalk with serving somebody who's 50 times the potency of heroin and allowing the patron to go back out in the street and do whatever, drive or God knows what.
I think the important distinction is that it is not, as far as I'm understanding it, the OPC is not serving individuals.
Facilitating.
They're
Can't deny
supervising.
that.
Individuals are bringing in their own supply of whatever drug it is that they're using, rather than, you know, the other analogy where a bartender is actively providing the substance. So I think that's
I get
an
that.
important distinction.
Right. I understand.
So, okay, and as we talked about it, remember the goal of having an OPC is to prevent death. So there's testing for the drug. There will be some provision for testing of some type for the drug that the individual might consume on site. But there's no provision in the bill that mandates that anyone working in the center would demand or require that someone consume the drug on site. It's all autonomous for the individual. And then the individual, what we know from other OPCs is that individuals are given opportunity to settle off a little bit. And then when they leave, and then they're under their own responsibility for their behavior or whatever else. So it is a fine line. I understand what you're thinking about. I think I understand what you're thinking about here, and is that what is the benefit of having this place if we let people consume potentially a drug that potentially has behavioral effects? On the other hand, we look at the lives that are saved, and we also look at the conditions within which the individual might be taking the drugs in the community, on a street, or in an apartment building, or under a bridge. And so there are consequences outside of the OPC. So the OPC is meant to be more of a clean, helpful and supportive space. So I think that's the way we look at it, and then you settle on whether you think that's a good idea or you don't think it's a good idea, and I can't tell you to do that.
Thank you.
So if, let's say we have a, fentanyl testing facility.
Yeah.
And somebody takes the drug that's supposedly clean, they go home and they overdose and die. Is that the private right of action that we're talking about, where somebody from the family can say, hey, just came from a OPC and his drugs were supposedly okay? I don't think you can get around the liability of that particular site.
I can't.
So we're not saying that we're gonna put the testing machines, there. Are we gonna be testing the?
Well, so there, remember the Department of Health is making guidelines around the testing, so, and rules, so we'll be seeing what they do. And that happens by September, so we'll know what they say about that. Yeah, there are always unanswered questions. What we do know is that there have been 0 deaths as a result of the use of OPCs across the globe, nationally, or in our view, in this group, and then in Canada, since they started 20-some years ago. Any other questions for Senator Hashim or Michelle on the proposed amendment? So is that the whole amendment that we're looking at?
That's it.
Big one.
And like I said, I think it was, from my point of view, when talking with you about this and your underlying amendment, I think it's really just kind of spelling out things so that somebody couldn't possibly read into the existing language that you could make, a claim under.
So some clarity offered, and greatly appreciated. Good. Okay. So we'll see this on the floor, I guess, tomorrow when we take the bill up.
Thank you.
Right, are you gonna take it upstairs for tomorrow?
I can do that. I think, I don't know what the process is. So would you folks vote on it and then I take it from your committee upstairs, or?
Will you take it up? Do you want, so the question is, are you interested in having other members sign on, or is this something that the Judiciary Committee would like to present?
I don't foresee us seeking other members to sign on to this.
Good.
I'm happy to present it tomorrow if that's when this bill will be up.
Yeah, that's good. I
So,
think that's what the bill will be up.
so it remains a judiciary committee.
Yes,
It's not in committee. So this is an individual instance of amendment because they don't have jurisdiction of it. So
Yeah.
it's, they just took it up as a kind of drive-by to take a look at that one section.
we're good.
Great, thank you.
Thank you. Thanks so much.
Can I ask a process question,
Yeah.
not related to this, but since we went through the order of the day, didn't hit any of the bills, but we had items on notice. Do all the items on notice move up to order of the day for tomorrow?
Yes, they do. They're up for second read tomorrow.
Okay.
So it's hit or miss. You don't know what's coming next.
That time of year.
Anyway, okay, Katie, you're here.
I'm still here.
So let's look at what we currently have in the bill for lead on S-25. By the way, so committee, I can speak for the committee. Is there anyone here who's categorically against that amendment that we just heard about? It offers clarity about immunity. So,
I understand the amendment, of course, so, the amendment, I understand.
yeah, okay. So we good with that? Senator Bullock, Senator Hardy?
Yes.
Sounds
like a good idea.
Okay, well, I think a majority of the committee, and when I say that, I mean that everyone has their hand up. I brought those in because it's near the end. I've got a few more in there.
Thank you very much.
And I should have got oranges too. I also have some other little surprises. Okay. All right, so lead,
Yes.
thank you.
So this is section 2 of the bill, and this language is that a manufacturer shall not knowingly manufacture, sell, offer for sale, distribute for sale, or distribute for use in the state any cosmetic or menstrual products that contains lead or like compounds that are exceeding 10 parts per million.
Okay, and the controversy around this one is whether or not there are, the supply chain includes components that are below 10 parts per million. So, and I honestly, just to refresh ourselves about this, tomorrow we are going to hear testimony from the industry. Including, we're hearing from Ian Flynn, Matt Chapman and Charity Clark, and then we've also added on, Kiki, we've added on folks from Dr. Eaton, Professor Emeritus of Environmental and Occupational Health at University of Arizona School of Toxicology, College of Pharmacy, and then Kathy Stanton, Senior Director of Scientific and Regulatory Affairs, Personal Care Products Council. So they're gonna be coming in to offer some insight into to that part of the bill. So we'll look at that tomorrow. So the only point bringing it up right now is it is kind of a conflict right now, what we're hearing, that what it can be done and what should be done, which is always, does become a conflict. When I'm also thinking about, Katie, are you aware of what Washington State is up to right now?
They have a 1 part per million, and then I think it doesn't take effect until 2025. So I think there's some question about perhaps seeing how that plays out. This has a later effective date as well. This provision, section 2, I have my handy chart in front of me. Section 2 is July 1/27.
So, okay, so the effective date for whatever parts per million or billion is 27.
Yes.
Okay, so we need to think about if Washington State is going into effect January 1st, 25, which I think they are. Might be able to learn something. So think about how we might want to modify this language, whether it's to go to the 1 part per million, or whether it's to hold it where it is, or whether to do something else based on what Washington State is doing. Yes,
What is the threshold for lead in water? Yeah, in the state of Vermont,
or civilian,
or parts per billion.
billion would be,
Okay,
but water's different.
yeah.
Yeah, different.
There was some testimony last week about whether, I believe this was in regards to lead, whether it was added intentionally or unintentionally.
Yes.
Is that germane here? Do we really need
Yes.
to talk about that? Or is-
Yes.
'cause it's not in there.
Do we have, what do we have in terms of intentionally added right there?
Let's go past it.
Yeah.
So that's. So this does not have the language about intentionally added in it
For which, the lead?
for the lead, yep.
Hmm. What are you thinking about that?
Well, I just remember it was mentioned last week,
Yeah,
Thursday, and, that, it is germane to where a raw material is sourced, what it actually has in its background.
Yeah.
As opposed to what's intentionally added to make it, for whatever chemical reason, but in this case, if it's unintentionally added, or not added, unintentionally involved. It's wrong.
Oh, sorry,
No, no.
are you finished?
It-
Okay. It seems to me though that it is intentionally added because some of these products are adding.
if they look at the source material and measure what's there, then it is intentional.
Yeah, it's not part of the manufacturing process where it's just sort of in the machinery or in, pardon me?
Source dirt.
Yeah, I don't know what else to call it, but the
Well-
source dirt has lead in it and they are intentionally adding the source dirt to the product.
Okay, so it's different. That's my question, is intentionally added, I get it, you know, that's a totally forbidden, should be forbidden.
Yeah,
But unintentionally added as a background material, I'm just wondering. I just don't wanna step off the cliff and realize, oh, made a mistake.
Agree with you. Maybe, so this is a great question for folks tomorrow.
Yeah, okay.
Yeah,
That's
no,
fine.
a very good question, and whether or not we put in that. What the implication of saying intentionally added might drive a company or an organization to have to measure the lead that's in the source material. Instead of just buying it off the internet. But buying it through the supply chain. Okay. Katie, you get what our questions are?
Yes.
So if we were to put in intentionally added, what would that mean for the cosmetics?
Well, without it, it's sort of looking at the product holistically and any amount of lead in there is counted towards that amount. You have a definition of intentionally added, as you know. The addition of a chemical or product that serves an intended function in the product component. So this is something that is specifically being added for a specific purpose within the product is what would be captured if you were to add that language.
Okay, so if, I mean, it does fit then.
I just wanna make sure we intentionally add.
You got it.
No, I just wanna make sure we intentionally have the conversation about it. If it's
Yeah, no.
you, and 10 parts per million is, you know, is total, whether it's intentional or unintentional. But I just wanna make sure we're not, because it was a kind of a kerfuffle version, and I just didn't want to pass.
We got it. So make sure we ask this tomorrow.
so we're not voting this today.
No, because we have people scheduled who have been, who have wanted to testify on this, so we'll bring them in and it probably won't, hoping it won't take a long time to do that. We can finally be done with it.
Okay.
Thank you. Is there anything else in this bill that you'd like to discuss? I'd like, because I agree, I think it's time. It's been sitting up there on the calendar for a while. We've finally had an opportunity to get to it, so we'd like to get it over and out. Okay. You don't have anything to do with 612
I do not.
cannabis. I think Michelle was. Michelle did. Let me drag her back in for 15 minutes. So one of the bills that we've been looking at is H 612 and which is the cannabis bill, and it has a section in it that relates to medical marijuana. And Senator Hardy and I each have spent some time talking both with the chair of the, or executive director for the cannabis board, but and also thinking about what's in the bill. We also received some language from Vermont Medical Society. Jessa, are you able to talk about that?
Probably can. I'm seeing if Jill can get over here too. I think they're actually doing 612 in economic development right now too. So that's okay.
So it would be helpful if you might want to share with us the language that VMS sent you. And then we'll move on to the other language. I was talking with Pepper this morning about it. So just FYI, the bill came from the Gov Ops Committee, I think, in the House.
In the house, yeah.
Yeah, and then it went to Economic Development Committee. Medical marijuana, last year, we put some language in that asked for some research-based information on the value of the use of medical marijuana. And the UVM Med School folks, assistant or dean, assistant academic, vice president for academic affairs, worked on that. And then that's what our goal in here is, to continue to have jurisdiction over the medical marijuana dispensaries and how they function and operate. I think it's inappropriate that they're all folded in together with recreational. The executive director for the cannabis board agrees with that and looks for our input. The chair of economic development and the economic development committee have also asked us for this input, so we'll continue to do that. I understand that there's some concern in the other body in the House that we're playing around with their jurisdiction, but it's not, it's ours. We're gonna continue with that. We were the first committee to work on medical dispensaries when it started in the first place, so we'll continue to offer our interest and expertise. So that's where it is. So there's a little bit of stuff going on outside in the hallways and the discussion. We'll keep working on this. So Jill, we're wondering if you might be able to go through the language that you sent on medical marijuana, and that you had some draft language, and I've asked him it on the webpage.
Great.
And if you have a computer, you could
Yes.
share Zoom and just put it up just for a few minutes. We have 15 minutes. I don't have any need for us to go further.
Is it on today's page, Kiki, or is it?
It'll be in a second, it was cute
Oh.
for tomorrow's, just.
I haven't had it up for tomorrow yet. This is an opportunity. We didn't know we had.
I've seen that.
Yeah, it's not awesome. Sent it out. Sure.
The other big chunk of what we have to look at is 121, excuse me, on data privacy. And one of the concerns that have been expressed to us by folks in the medical world is having some institutional exemption because they already go through HIPAA. I'd like us to consider that. And then also to consider what private right of action might mean. I think currently in that bill, there's a report and a study and an analysis that would go to different committees, and I'd like to include our committee in that analysis, if we can do that. But we will hear from the Attorney General, who is very interested in having a PRA, so that'll be a decision we have to make.
So how do you, sorry, technically, enact here, you want me to join the Zoom link so I can share my screen?
Yes, join the Zoom link, and then you share your screen. And we look at the language, and we can go over a little bit today because we got free time. Not that there's ever free time in this building. So remember, when we listened to the testimony on medical marijuana, we heard that there might be a case of moving medical dispensaries into the same facility as recreational. That opens up significant questions about patient confidentiality, rules and training for the folks who are behind the counter helping patients and how to work with patients. So, a lot there. Okay, so Jill, thank you for being here. Why don't you introduce yourself for the record and then walk through the language that VMS is suggesting.
Yeah, so I'm Jill Hopkins, representing the Vermont Medical Society. And last week we testified and we were suggesting that if you're gonna move forward with this medical endorsement process, that you should put back in statute the requirements for a bona fide healthcare professional patient relationship, which when the medical program was first initiated, that was a requirement. It's a requirement in most states with medical programs, and Vermont's was not less than 3 months duration. So it's really that you have a relationship with your doctor, and really it's just to avoid people getting, that website visit that really isn't medical care as a confirmation. And I actually have information to share about that too. Just that our doctors are getting asked if they want to part of those website kind of rubber stamping right now. But the language is really what was in statute before. And so all the pieces that are in yellow are what we're suggesting.
Just hold it right there.
Yeah.
We'll read through it. Go ahead.
Can I ask for clarity? So, when the cannabis bill was originally passed, the requirement for patient-physician relationship was 3 months.
Yeah, so that was when the medical cannabis,
That's good. And then now, what is the requirement?
well, interestingly, we didn't know when it was out of statute, so
So
this,
what is it now?
it's nothing.
Thank you.
It's just that you need to have a healthcare professional certify that you have one of the qualifying conditions, but there's nothing else beyond that.
Question, go ahead.
Yes, thank you. Can you please correct me if I'm wrong, because I definitely might be, but it seems like this is all about the fact that some patients require really high dose levels of THC, correct?
Sure.
Yeah, and that's really the issue that we're grappling with, correct? Trying to carve those folks out of the marketplace, so to speak, so that they can have sort of a separate treatment that's not available to everyone else.
You're talking about the medical endorsement process?
Yeah.
Yeah, so that's what we understand from the CCB is that there are some products that are only available on the medical market, that are not available on the recreational market.
With high levels of THC.
Right, that some medical cannabis patients that are on the registry may have gotten used to using. I don't think anyone's required to use anything. It's all a matter of choice. And so the CCB is saying that they want to have this medical endorsement process. And so the issue for us is that we see that now you're going to have access to the high potency products it's more available. So you should not create a loophole of making it very easy for people to get certified for their conditions so that there could be abuse. Because the whole idea is that we're not putting this into the black market, that this is a justifiable use. And so that's the issue there. Correct.
And I think the other part of it is the qualifying medical conditions, which conditions are actually responding to this type of treatment. So that having some kind of evidence that you'd be able to base your decisions on. And so if it's spider's web, you want to make sure that it's available in the medical dispensary because it's required for certain, and especially kids, pediatric patients, and it shouldn't be in the recreational level because it could may result in some harm. So it's trying to find that balance.
I think in addition to the high potency thing, it's also for the recreational market is 21 and over, so this would have younger people in it, so it's the age and the potency.
Thank you.
And I mean, I don't know, a little bit for me also, and probably for you, is that if we're calling something medical, then it should have some kind of, at least a little bit of medical sort of basis for it, otherwise it's recreational, so
Right.
there's a just difference between why you're using it in the two markets.
Yeah, it's really that we've seen that the number of patients on the medical registry is going down. So it's really not about access at this point. So you really need to have something that's credible, evidence-based, and have that delineation between the medical and the recreational. I think that's very important. And we looked at what other states do for the 18 to 20-year-olds, and Colorado actually has a provision that people between those ages actually need to have 2 healthcare professionals verify that they have the condition, just to give that extra. So we did put that language in as well. And then that they would need a follow-up in 6 months to verify. Just to really understand. It's also about use in that age group because we know cannabis has a different effect on the developing brain, and so really looking at is this treatment working? And so it's really about safety.
So is it from your experience and understanding about the medical program? Are there kids younger than 18 who are being prescribed? Can you talk about how they're handled?
So no one's prescribed, but
But
they
not prescribed, given the card.
right, that they would be certified for the condition. That is different because a parent needs to sign off on that. So not only does the healthcare professional need to certify that they have the condition, the parent needs to sign off on that. And then there's caregiving. There's the statute around the caregivers and what they need to do around that as well. I don't have anything, we could try to find some information if you're talking about like what the experiences for those under the age of 18, but I don't have any of that right now.
Well, today with the medical dispensaries, things are pretty well contained.
Yeah.
If there's a shift to having it that's a whole different perspective for a parent going in, maybe going in with a kid.
Right.
So there's a lot there that, and we've actually sent some notes to Michelle about how we might want to talk about that in committee. But I'm just concerned about having this go forward without that conversation.
Yeah, it's really about clarity and trying to ensure that it's done the right way safely. And I think that the 18 to 20 years of age is really where there is some concern because they don't have that parent sign off.
Yeah.
And we know
Got it.
that's, yeah. So that was that. Like,
So let me remind us, the yellow that you have up here was,
is the new,
this is new.
right?
What about the yellow up above? That used to be,
This is used to be.
Yeah, this is a used to be,
so We
but it's
put it in
new.
yellow because
Okay.
it would be new.
All right, and then keep going. Well,
Sorry, and then this is the younger patients, and then this is, what was in the bill, around the medical endorsement rules, and so this, is like for the medical program right now, what exists, so it's not underlined. And then the underline is what is new in the bill. And then the yellow is, so hopefully that's clear to you.
We got it.
But for us, again, it's important when you're thinking about, people that are on the medical registry and they want that confidentiality. So how would this medical endorsement process ensure that when there's a retail market as well? Looking at the health information protections. Again, if you're gonna call it medical, that it should have these protections. We added that disclosure that, that any medical interactions and any consultation around that, this is, it's not evidence-based like FDA medical advice. This is often coming from people that are passionate about using cannabis for specific symptom relief. And then for us, something that's coming up in Senate Economic Development, which is where I just was a concept of removing all of the advertising restrictions. The medical program, when it first came out, had very strict advertising that really couldn't advertise. And so we're saying if you should adhere to those same kinds of advertising rules that are already in our regulations. We're concerned about the removal of advertising restrictions, especially with social media. It's just really normalizing and promoting, and with the lack of real effective age gating, it's very easy to say, yes, I'm 21 and move forward. So
You can finish. I just wanted to say.
She said putting her hand.
yeah. And then delivery is something that only exists in the medical market. Very few Vermonters use it, but those that use it may need it. I don't know
Yeah, no, we
specifically,
heard testimony years ago about the need for delivery for some folks, in particular with some neurological disorders.
Yeah, and I think that there's been issues with that, so we're just saying that that should be, have all of the patient verification pieces, just so there isn't loopholes. And then, that rulemaking really needs to figure out how do you clearly delineate the physical space for medical and products that are different from what's sold in the adult use, so you're not promoting that high C.
Senator Hardy and then Senator Gulick.
Okay, well, first of all, I do want to say that there is really strong age gating, I think, in our current cannabis law. I mean, it's really hard to get into a shop.
No, not into a shop, online. I meant this, they're really pushing to remove the social media and online to loosen those restrictions, and so when you go online.
Specifically for advertising you're talking about.
Yeah.
Oh, okay.
Yeah.
Because just to get to buy it,
Right.
there's strong age gating, so I would.
You can buy it online though, too, so.
And in terms of advertising, I think we have to be really careful that if we're gonna keep advertising for the medical, that it adheres to whatever advertising laws apply to other medical things, not what might have previously been in statute for cannabis, because I think there's some concerns about the advertising law. The advertising and whether, the advertising restrictions and whether they're constitutional, that's what my understanding of the conversation is right now. So if we're gonna put advertising restrictions on this part of it, they need to be similar to whatever advertising restrictions are for other medical products, not totally different, otherwise I think we're gonna have some concerns.
Well,
or some
we'll have
problems.
to ask that
Yeah.
question of Michelle.
I think there, so for the bill, just in general, I think there are a lot of things in the bill that we, or I don't wanna hold up, so I just wanna make sure that whatever we're doing doesn't hold up the whole bill, and I think it might be helpful for you and Pepper to talk about what.
Well, we're not there yet, Senator.
Because-
We're gonna talk with our ledge council tomorrow. And we'll be able to resolve a lot of this. And then
Okay,
we're
as long as
also
that's-
talking with ledge council on Thursday. Let's not jump ahead yet.
Okay, I just wanna make sure that we're not gonna hold up the bill, cause I think there are other things in the bill that are
We're not.
really important.
We're not gonna hold the bill up.
It's
Not us.
getting
But I do,
late in the session.
but no, we're gonna finish the work on the bill this week. We have this week. And we will be proposing our amendment as economic development completes it.
So they're not done in development, okay. Alright,
Not yet.
got it.
We
I
have
will just
loads
take
of time.
No, we don't have loads of time. I know everyone feels
pressure.
pressure, but guess what? If we don't do it, we don't do something here, it'll be gone. And we're gonna see some problems out in the real world if we don't have what we need in the bill. So Senator Gulick, Laura Gulick.
Thank you,
Well.
Chair Lyons. So let's see. I don't know a lot about this stuff. I'll be honest. I believe that the reason doctors can't prescribe this medication and pharmacies can't give it out is because it's illegal at the federal level, is that correct?
Schedule one.
The schedule, okay.
Mhm.
So that's what trips all of that up.
It's part of that, yes, well, definitely that's it.
Definitely that, yeah.
But why like the body of evidence, because it's a Schedule I, it has not been through a lot of the body of evidence
Right,
to
right,
really
yeah.
determine like this is
Yeah, and I can do this.
treatment for this symptom.
Yeah, I can do my research out of this committee, but I do wonder what other countries do, because I feel like a country like Germany, let's say, I don't think cannabis is legal there, but I'm sure they prescribe it to patients and people use it for medical treatment.
I don't know.
All right,
I don't know either,
I'll do.
but
They do a lot of things that we don't.
Yeah, I know, I'm just curious how they thread that needle. It would be
Well,
interesting to
stop.
know.
Well, they don't do it.
Clumpers or Linda Clumpers, who was here in front of your committee last.
Yeah, she might, oh, she was probably know.
She might
Yeah.
know,
That's a
because I
good
think
point.
she's from Holland.
Yes,
Right?
yeah, she's, yeah.
So here's what I'm gonna suggest. Thank you for bringing this language.
We have one more piece, just on.
Okay,
medical
very
cannabis
quickly, because I want to ask
advisory
the
board.
committee a
Yeah.
question.
We had suggested that it would be great if there was an independent advisory board that took on these questions of qualifying symptoms and THC potency and things like that, so.
Yeah, so we can look at that. So an advisory board, that would, support the cannabis board. My question is, the report should come back here and to the House Committee on Healthcare. I don't know why GovOps would be involved in a medical decision, but they're certainly welcome to it, both the House and the Senate. Oh. Anyway. Okay.
Yeah.
So think about that committee, trying to maintain some jurisdictional oversight for the medical distribution of cannabis and the medical dispensaries. I think that there's an interest out in other parts, other areas about fully integrating recreational and medical, and that would change radically the level of THC available and the plants that are available that may or may not be appropriate recreationally. So, thank you. We're good. We're done with that. I do have a question for the committee before we, back to the day, and that is, we have JRS 44, which has been, we have draft, new draft, which is the public health, emergency for, drug overdose. Do you want to look at that right now?
I need to get to know.
You need to get somewhere. Darn.
I
Okay,
can do it.
no, I'm happy. We'll wrap for the day and then we'll pick that one up another. Thank you.
And we're gonna do a confirmation, appointments on Friday, cause I did get a hold of one of my guys, but not the other one still.
My other one hasn't replied yet. I'll rattle her cage again and then that's that for you, okay?
Yeah.
All right, we'll do that.